Hello, listeners. Welcome to Views on Health. On the program tonight is Dr. Pravin Wijesinghe, consultant plastic surgeon, University Hospital, Kotalavala Defense University. Welcome back to SLBC and the program. Doctor, it's good to have you with us.
Hi, Fatima. It's good to be back.
And for the information of our listeners, the topic under discussion today is liposuction. Without any further ado, over to you, Doctor, to introduce the topic.
Yes, so liposuction is exactly as it sounds. You remove the fat, which is the lipid tissue, by sucking it out. So there are various medical devices that, when applied to the body, ruptures fat cells. So although we think fat is just existing in our body, it actually is, they are all cells. They are fat cells that are there that harbors the fat. So if you can rupture them adequately, you can suck the fat out, and that's what liposuction is. When we do suck it out, we do not remove all the fat in the body. We target certain areas, and even in those areas, there's a certain limit to what we remove, because fat is important to us. We are skin, and then there's a layer of fat underneath before the organs and the abdominal wall comes into play. So all we do is remove a reasonable amount of fat to get various desired outcomes, and that's what liposuction is.
So what parts of the body would you have this procedure on?
Technically, Fatima, you can use liposuction on any part of the body where there is fat. So commonly we use it in the abdomen. We can use it in the abdomen isolated, just as a simple procedure where we just do liposuction, or we can do it in the abdomen where it's a part of a bigger procedure, like an abdominoplasty, where we remove the fat and the skin, and we do a bit of liposuction just to contour. We can do it into the arms, where people are having larger, thicker, chunkier arms, or we can do it under the chin, we can do it at the thigh, we can do it as part of a gynecomastia treatment, the chest wall in males. So wherever there is fat, we can technically take it out.
So in other words, even males go through this procedure, because we think it's the females who have sort of protruded abdomen who will want it done. It's a cosmetic process.
It is a cosmetic process, yes. But the world is very progressive now, where men, women, it doesn't really matter who wants it. If there's someone that wants a desired outcome, whether it's cosmetic or structural and functional, we can do the same for anyone, basically.
So how would you decide that this person can undergo this procedure? Now, somebody comes and says, Doctor, I need to get this done. Would it mean that you will just say, okay, let's do it? Or would you have to, really assess the patient, go through certain tests, and then does age come into play and other factors to ensure that what is done is of benefit to the person?
Okay, so when patients come to us, they have various desired outcomes. We need to make a call for ourselves and then have that discussion with the patient, whether the patient requires it, number one. If they require it, does that give them the right outcome? What is key about liposuction is it does not do anything else. All it does is remove fat. So if, let's say, a patient comes to you that has fat but not a lot of overhanging or excess skin, yes, that patient requires liposuction, of course, within certain safe limits. But if a patient comes to me and says, Doctor, I need liposuction, but the patient has a large protrudent abdomen or it's overhanging over the waistline, just by removing the fat, all we are going to do is make the skin sag more. And that outcome is completely undesirable. So not all patients can have isolated liposuction. There are other procedures for it. They get assessed accordingly and then advised on.
So is this process considered dangerous for any reason?
Fatima, it is a surgical process. It's a surgical procedure. So it's generally in Sri Lanka done under general anesthesia. So when it comes to any surgical process under general anesthesia, you have the complications that can technically occur as part of the anesthesia process and as part of the surgical process. Having said that, the biggest benefit of liposuction versus all the other things is that it makes this tiny cut. The cut is actually less than a centimeter long, and through that we introduce this cannula which sucks out the fat. So as far as a cut goes, or incision goes, it's a very small incision. But of course, you do rupture the cells. You can get a bit of bruising, which is common. We completely lyse the fat layer and then try to remove it as much as we can, which causes a bit of numbness in certain areas. So bruising for 2 weeks, numbness lasting sometimes for a few months is the common scenario. If you do not apply it properly, it's a thin metal rod that gets introduced to the body that can damage certain tissues. So there's always a significant amount of safety protocol that we follow to make sure that those patients don't have any complications. On top of that, when you operate on fat, there is a risk of causing fat embolism. Now, fat embolism basically means you get bits of fat that goes into the bloodstream and then goes and blocks the aeration process in the lungs, which can be deadly. So there is a lot of safety that we need to take into account. We do say no to certain people who come, especially with comorbidities, patients on certain medication that can cause a lot more bleeding than normal. But as surgical procedures go, it's less invasive and less complicated than some of the others that are in this field of cosmetic body contouring surgery.
So this process will take time.
Yeah, so that's the other benefit of it. It's a relatively simpler procedure. I'm not saying it's simple, I'm just saying it's simpler. It's done as a day surgery, so the patients come to you fasting for 6 hours, get admitted 1 hour before we do the procedure, and then basically send them home within about 3 hours after the surgery. So the whole process is about 6 hours in the hospital. What we need to remember is all we do is remove fat, and then that excess skin, even in a patient that does not have a lot of skin, needs to get tucked in, tightened to that the new frame. So we need to give them compression garments. It can be to the chest, it can be to the arm, it can be to the abdomen, it can be to the thigh, but that compression is important because now there's loose skin, not as much as a very heavy set person, but then there's still loose skin. You need to tighten that. So they are put on this compression garment and then sent home. So as a procedure goes, it's a relatively simple, short procedure.
Thank you, Doctor. Interesting. Now, how would you decide that this patient can undergo this procedure?
Okay, so there are absolute contraindications. If the patient is ill with other things, like let's say this is, as I said, it's a general anesthetic procedure. If the patient cannot undergo anesthesia for some reason, with this heart disease, where there is some significant airway problem, whether the patient's allergic to certain medication, those are absolute contraindications for getting any procedure, not just liposuction. If the patient is having bleeding disorders although the cut is tiny, we do go under the skin and then we do an extensive area of liposuction. So if you start bleeding into that patient is going to have lots of problems. If the patient has had a history of deep vein thrombosis, fat embolism, for example, we do not take that risk on those patients. Of course, we explain to them as to why we wouldn't want to take that risk. Whatever we do, patient safety is a priority in our practice. So we have to make sure that we assess these patients for contraindications. Firstly, assess them whether they need the surgery in the first place. Some patients don't have fat at all. They want liposuction. Then they're not going to get that.
Now, you said that post-surgery there could be this bit of bruising and numbness can go on for a couple of months. Now, assuming that the patient recovers totally, and I'm sure they do, that's the idea behind doing the surgery, you will ensure that the patient is now going to be good. And the patient will also feel good that the excess fat has come out of the body and now you look better. What sort of post-surgery advice do you give your patients?
So immediate post-operatively, we ask them to rest a bit because it is still a surgical procedure, although the scar is tiny. So we do not want them, going through physical exercises. We don't want them to go into contact sports or go to the gym soon after. I mean, most of these patients that come for us for liposuction are patients who have problems with their appearance, so they would still want to go back to the gym. They want to go back to swimming. So we tell them not to do that for about 2 weeks. After that, they generally get introduced into getting back to their normal routine as long as they don't have pain. What is very, very important going down the line is that you need to know that all we've done is just remove the fat. We've not removed it completely because you need a little bit of fat left behind. Those fat cells that are left behind can enlarge again, cause fat hypertrophy, and you can get that weight back. So is it a permanent fix? The answer is no. If you are not maintaining yourself in the long run, there are patients that come back to us and say, look, doctor, I lost a lot of weight, but then I've gained it again. And that can happen. So you need to tell them that. Number one. Number two, can we do liposuction again? The answer is also yes. It's tougher than before. It can bleed a bit more than before. The procedure might take a little longer, but can we do it again? The answer again is yes.
In fact, you answered my question because I was going to ask you, there are certain people who have undergone the procedure and then they say for a few years everything is good, but then they tend to neglect themselves, can I put it that way, and then maybe indulge in certain foods that bring the fat back into the body. And then they are back to where they were before the procedure. So in that situation, and you said they can come back or they have come back and you can do it again, but there are sort of, you have to obviously assess the patient before you do whatever to do, but it's possible.
Yeah, it's definitely possible. What's key is we do not remove every single cell of fat. We shouldn't remove every single cell of fat. You can't leave just the skin and the muscle behind. It's not safe for the patient. So we do leave a bit behind, and that can enlarge over time, especially if you're not careful with your diet, your physical status and all that. You can get that hypertrophied again, and then you can gain that fat and then gain that same appearance. Can we do it again? The answer is again yes, but as I said, it's tougher to do it. It takes a little longer. There's more scarring this time. So that's how it goes.
If the patient is careful in terms of diet and exercises and maintains the figure that has been, can I say granted after surgery, put it that way, then they can carry on like that without surgery. But meaning they will not put on more weight. And you explained this absolutely. I think it makes sense that you have to have some fat in the body. So you, as a doctor, you will ensure that that fat remains in the person. But thereafter, the person has to be careful not to allow it to get out of hand.
Exactly, Fatima, yes. So the other thing is, with liposuction, something that we didn't talk about is, so whatever fat we take out gets discarded because we don't need that anymore. Very rarely, patients might come and ask us to use that fat for things like fat filling. It's called lipofilling. So you can that's good fat. That's good, healthy fat. You can introduce it back into a patient in certain areas. That could be a place where there's a scar in the past. There could be a dent from a different scenario, like a trauma, or if you want to physically augment certain parts of the body, it could be breasts, it could be your buttocks. So you can use that live fat as part of a lipofilling procedure. Of course, that's a different process. It's not just liposuction, but you can use that fat again. So it doesn't happen too many times. Most of the time, you just discard it, but you can use that fat again. Yes.
So that means how is it preserved?
So you do that at the same time. So as long as there's enough blood supply to the fat, they don't die. So if you introduce the extracted fat back into the body, into probably a different part of the body, 60% to 70% of that fat survives. So if you, let's say you reintroduce 100 milliliters of fat to some part of the body, that fat will be 70 milliliters of volume will be retained. In fact, I use that a lot when I do breast asymmetry surgeries, where you're born with the breast which are either small on one side or too large on one side. If it's small on one side, we can sort of start lipofilling that side to bring about symmetry.
Interesting. So, doctor, that procedure has to go on shortly after the liposuction? Because you can't wait?
You generally don't wait. We do it at the same time. It's a simultaneous. So you extract the fat, settle the bleeding. If it's so, close the incisions, put a dressing on, then you start filling the fat. So you need to. Fat is not just fat at the time of extraction. There's also fluid. You remove the fluid part of it, and you take the good fat, which is yellow in color, and then you re-inject it into whatever part you want it ejected to.
So it's like simultaneous. I mean, the sense one you do this and you go on to the next thing.
Exactly.
And the patient is in a situation or position to go through that.
Exactly. So it's the same anesthesia. There's no added. It just adds to the duration of the procedure, and that's it.
At what age do you take your patients in for liposuction? Would it be like somebody who's old? Will you say, no, I don't think this is recommended for you? Or somebody young?
So there's no age restriction with regards to advanced age. I wouldn't do liposuction on a 18-year-old or anyone less than 18 years of age. But anyone more than that, I would do liposuction at any age, as long as they have fat, as long as there's an indication for it. With advancing age, of course, it's the opposite. You don't have fat. You start losing the fat tissue, and you start getting, the skin becomes more droopy, for example. And that's where you basically take fat from somewhere that's excessive and then maybe inject it into certain areas to bring about the appearance of health or youth.
Interesting. Thank you, doctor. So, liposuction, how often is this done here?
The numbers are increasing every day. We used to do once every a few weeks, but then now we're doing almost every week. Quite a number of them, actually.
So that is because people are aware that this procedure can help them to get rid of excess fat from whichever part of the body they don't want to have it in.
Exactly. And also it's less invasive. It takes a shorter duration of hospital stay when we start doing it. It's less costly. So it's a relatively simple procedure. And people are getting aware of it, especially the younger males who want their chest contoured. In the case of gynecomastia, so unlike those days, we exclusively treat gynecomastia through liposuctioning currently, unless they have a lot of excess skin, but that's a different procedure.
Yeah, I think it'll be interesting to speak on that as well when we do another program. So finally, doctor, liposuction it is, and you say it's more and more people are coming with a request to get it done. And what would be your advice to our listeners out there if they think they need it? They have to come and get medical advice. They cannot assume that this is it. Would there be a patient who has come to you and you have said, no, this is nothing to do with liposuction, it's something else?
All the time. So there is a lot of material out there on the net, on YouTube, wherever. So people are getting confused about what it is. So it's really important that you come to us and we have this, constructive conversation about what it can give you. There are a lot of patients that come and say, oh, I need liposuction, but they probably need a weight loss regime preoperatively rather than just remove fat, because their excess is not just fat, there's visceral fat, there's excess skin, so they need a complete different procedure. So come and talk to us. I think that's what's important. Let's have a conversation about whether you need it, number one, whether if we do it, you will get your desired result, and that's what's important.
So if you decide that a patient has or rather needs or can get this procedure done, what sort of preparation do you have beforehand, and how long does that take? Of course, it can vary from patient to patient, but generally.
So currently, unfortunately, it's not available in any of the government hospitals. It's currently available only in the private sector. There's no special prep unless you're on special medication for certain other things. Then, of course, we'll tell you what to stop and what you can take. As far as the procedure is concerned, all you need is 6 hours fasting. And you need to remember to bring that garment I was talking about, the compression garment, which has to be pre-bought. Because as soon as we finish the procedure, we put you into that garment and take you out of the theatre. And that garment has to be worn for up to a month and a half. Not all the time. You can obviously take it off when you take a shower, but then most of the time, because that's going to reduce the pain, that's going to reduce the edema, it's going to make the skin shrink quicker. It's going to reduce the bleeding. So lots of benefits of wearing a garment. And those are the only things that you need to do before coming into a procedure like that.
Is it something comfortable to have?
It's like Lycra cycling shirts, cycling shorts. It's just a tight thing, but once you wear it, wearing it is a bit of a hassle. But once you wear it, it feels snug and feels very comfortable, yes.
So that's a good thing.
Oh, it's definitely a good thing.
Doctor, what's your final message to our listeners?
So just to make sure that you know about liposuction. Liposuction is not for everyone. It's a surgical procedure with its own risks, but it's a relatively safer procedure compared to the other things. Not everyone should have it. Not everyone can have it. So let's just have a conversation with us, and that's what's important. It's still a surgical procedure with its own risks, and that's very critical to remember. It's still that it's a surgical procedure.
Thank you, Doctor. It was good to have you on the program, and I'm sure our listeners would have found the topic very interesting. Thank you once again to Dr. Pravin Wijesinghe, Consultant Plastic Surgeon, University Hospital, Kothalavala Defence University, and we sincerely hope Doctor will be back with us to discuss other important aspects of plastic surgery. My thanks also go to Prabhavira Surya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next week, same time on Views on Health.